everyone. My name is Kelsey Haynes. I also work in community relations here at Spectrum Health, and I have Dr. Donald Kim with me as well. He is a colorectal surgeon with the Spectrum Health Medical Group. We wanted to talk today to you about colorectal cancer awareness as March is Colorectal Cancer Awareness Month. Kind of want to talk about some of the risk factors, treatment options, and preventative screenings we can do. So Dr. Kim, what are some of the risk factors for early detection with?
So when you're looking at risk factors, probably one of the biggest ones is family history of colon cancer. So if you, as one of your first-degree relatives, i.e. your mother, your father, your brother or sister, have colon cancer, that puts you at an increased risk. Certainly there's some other disease conditions like inflammatory bowel disease that might be an additional risk factor. And there are, as we age, like with anything, our risk of colon cancer increases as well. Certain ethnicities, African Americans, have a higher risk factor as well. So those are the predominant risk factors associated with colon cancer, colorectal cancer.
So what about, so let's say I'm worried. What might be some of the symptoms that I might have if I was?
So you being so young, it'd be pretty unlikely. So, in our minds as healthcare providers, you're low probability, but I can tell you, even in the patients that are older, if you look right here, this is a blank sheet of paper. That's the point. Asymptomatic is probably patients that have no symptoms are the by and far the most often diagnosed with cancer. Certainly those that have rectal bleeding, it's something that should be looked into. Change in bowel habits, change meaning narrowing of the stool, a feeling like you're not emptying, other things, abdominal discomfort, from a blockage or obstruction. When you're looking at some of these other things though, especially like blockage or losing weight, just feeling fatigue, a lot of times that is indicative of an advanced tumor. Tumors themselves, they can shed blood microscopically, and that in itself can cause an anemia that you aren't aware of, but you come up very, very fatigued. And so that may be another presentation. And again, that may not be bleeding that you'll see, but it's something that once they maybe check your blood count or something, or one of the screening tests is called a fecal occult blood test. They check your stool, and that is positive, and that may prompt additional testing related to that.
So are there, you mentioned that test there, are there other options that we could look at? Like I know I've heard of colonoscopies and things of that nature. What are some of the options that are available?
Certainly colonoscopy is probably the most known and probably the gold standard examination. We are actually looking at the organ that is going to be causing the problem and making the diagnosis of one, the precursor lesion or the starting lesion, which is a polyp, or even a cancer. That is the standard screening test nowadays. Recent developments include actual stool DNA testing that maybe for people that don't want to go through that, what they perceive as a risky colonoscopy, which is actually quite a safe test, but they have some fear of that test. It actually looks at the DNA of the patient and looks for the DNA associated with cancer and can predict those patients. Having said that, once you have that test, then you have to go the next step and look for the cancer.
So with that, are there any options here at Spectrum Health, whether it be treatment options or things that our team has on staff that might be of interest to the viewers around colorectal cancer?
Looking at screening, colonoscopy, we are probably the busiest endoscopy center in Western Michigan in terms of doing the standard screening colonoscopy. I did mention DNA testing, which is, again, something that is available, and many insurers are providing funding or are paying for that testing. And then there's also what's called CT colonography. Now, that's a different technique using radiologic imaging, CT, to look at the colon or reconstruct the colon with CT imaging, and it's what we call a virtual fly-through through the colon. Now, with that testing, you do have to do the standard prep, and there's not many places that do the CT colonography. Spectrum Health is one of them. Along the lines of the colonoscopy, the other tests, they diagnose that there may be something there, then you do need a colonoscopy. What is nice about colonoscopy, even let's say we use it as screening, you get an examination. That examination notes a polyp. So sometimes with screening tests, you get the answer that you've got a problem, but you have to wait for something to happen. Colonoscopy, it's same-day service. You get a colonoscopy, you have a polyp, it's usually going to get removed and taken care of at that moment. If it's more than that, if it's a tumor, as a colorectal surgeon, that's kind of where we come in. We start with the options related to surgery for those issues or colon cancer, and we actually also have a multi-specialty team that combines radiation oncology, the medical oncologist, a nurse navigator, and we see the patient all together with our radiologists and our pathologists, reviewing the whole presentation, and then we come up with a treatment plan. So typically we're using that for rectal cancer. We're also using it for complex colon cancer, maybe that has spread to different areas, and starting to see our standard colon cancer patients as well.
Oh, very cool. So it sounds like a team approach. And speaking of teaming up, I just wanted to share, so Dr. Kim and I both will be at the race day. Dr. Kim is our race executive sponsor. He'll be doing the start countdown. For those of you who are curious, today, this is the shirt. We're really excited. Long sleeve dry fit shirt. We've brought back the dry fit shirts for the Irish Jig. And again, interviewing today Dr. Kim in relation to being Colorectal Cancer Awareness Month and the Jig supporting that. We're really excited about this year's Jig. For those of you who are interested in running or walking the Jig, it's a great race. You can register at spectrumhealth.org/Irish Jig. Again, that's spectrumhealth.org/Irish Jig. There's tons of information about the start time and racer information on the website. We're really excited. We hope you can join us. We've got really cool things like a gear check capabilities this year, so you don't have to run with your keys, for example, if you're parking your car. And we also have a photo booth in our gym this year, so you can wear some Irish Jig themed items and take a keepsake home with you as a photo with your friends and family. So we're looking forward to seeing you on March 19th.
That's great.